I would say that the robotic PCI is a new setup for CAD lab. We are very far away from the Andreas Grinzing story over this almost 50 years. And now with robotic PCI, we have the different settings. Operator is out of radiation zone, usually in control room. With the higher precision of robotic arm and higher precision of movements and sound automation, is able to maneuver with wires, delivery system of the balloon or a stent, and with this higher precision is able to control the procedure from remote. It could be the control room or it could be telestenting, so it means that it could be possible to use this technology from remote hospitals. So the system is allowing also to be without aprons. So it means no radiation and not heavy aprons, which is of course means less orthopedic problems for physicians. Reduces the burden on operator, which giving less fatigue, which is translating for sure for better concentration of operator and also precision of movements, especially for ostial lesion, bifurcation, and some automation is giving new opportunity. I think the Tesla registry is very important study because the first time in Europe we have collected the data of more than 500 patients done mainly in Europe from different centers. And it's clear that we have the very high clinical success rate at the level of 95%. And very important that 75% of all cases were done completely with robotic arm. Moreover, around 15% were done by purpose as a hybrid approach, so small manual conversion, manual assistance for some part of the procedure, and only 9% were really converted into permanent manual. So it means that 90% of cases really could be done, and moreover, we checked that majority of our patients were with the moderate and complex lesion and not simple one. So it means that with the second generation of robotic system, nowadays we are able to do 90% with the robotic assistance without radiation and without heavy aprons. So I think that's a new finding, new era and confirmation that Europe is active in this field. I think that the robotic is coming. When we look for cardiac surgery, which is also important for us in surgery, we know that the robotics are more and more commonly used. And in US, we can see that 15% of the operations on mitral intervention are done with robotic. I think that also the PCI is coming to this journey. We see more manufacturers which are preparing the new robotic systems. And I think that keeping this experience, more advanced technologies with the robotics and going even for complex lesion, including telestenting, so remote control on the hub and spoke model, I think that the future is coming. I think, yes, all the time we see with new technologies, there is a big enthusiasm, then it's a little going down, and then is going up with the immature phase. So I know that this is the early phase, I would say. We are just looking, but I strongly believe that with the involvement of surgeons in cardiac operations, and this benefit is clear for interventional cardiologists not being in the X-ray zone, reducing this exposure and less fatigue and less orthopedic injury, I think that with this precision, it makes sense.